Welcome, everybody, to another episode of the Nutrition Hero Podcast. I'm Dr. Brad Watts, and as always, I'm your host. I'm going to be here talking today about the science of functional medicine. Maybe we'll throw a little art in there as well, but those are the two things that we celebrate every single stinking episode. So, all right, if you've been with us for the duration of the podcast, I appreciate your support. I like the questions you guys are sending in. It's almost time to do another mailbag episode where I answer the top questions that I'll find in my inbox. So if you do have questions, just email me at Brad, B-R-A-D, at biogenetics.com. Brad at biogenetics.com. A couple of housekeeping things I want to take care of before we get going. I will be next month, which will be November, in Arizona speaking at a blood chemistry course. And this is not your daddy's blood chemistry course. This is going to be an advanced blood chemistry course, or what I would like to say an accelerated blood chemistry course, where we're actually going to talk about how to treat your patients, not just what BUN means, not just what your creatinine values are. We want to talk about some actual how do you take this information, put it into your practice, help your patients get better. So many times in functional medicine, we get this thing where it always turns into biohacking, where people have this is the nutrient you use in order to get this reaction. You get this nutrient for this problem. And when we're talking about healing, it's so much more important than take vitamin C. Or like the other day, we were talking about anxiety and GABA, with probiotics, etc. That's not a treatment plan. That is a tool that we used as part of a treatment plan. And so when we put this package together, the blood chemistry course that I'm going to be teaching here, sponsored by Biogenetics, is a way for you to systematically analyze your patient's data. And not only that, but create meaningful programming that you can coach them in the right direction and push them along the way toward actual healing. That's the important part. And so anyway, that's coming up. If you want more information on that, you can email Kari, K-A-R-I-I, at biogenetics.com, Kari at biogenetics.com. All right, today what we're going to talk about to begin with anyway, is, and kind of see where it goes, is I want to talk about antibodies. And so we have this thing that I recommend quite often for patients and for doctors that are looking at helping chronic disease situations. Food. We want to know food antibody testing. We want to know what's going on when it comes to basically not only just reading the antibodies, but what's the validity? How often are they hanging around? What are we finding is an appropriate recommendation for length of time that they follow food planning as far as antibody tests are concerned? And so we're going to get into that a little bit today, but first I want to talk about a few of the terms that are maybe new to some people when it comes to antibody testing and talking about antibodies specifically. And so anytime that we have, I'm just going to read a definition for you here, but anytime that we have antibodies, we also have to be talking about antigens. And so let's take something maybe that people don't care about, like a peach, right? Let's talk about a peach. A peach can't offend anybody. So we're not talking about grain, we're not talking about dairy, we're talking about a peach. So in this instance, when we talk about antibodies, the proteins that your body's creating in order to attack an antigen, the peach would be the antigen, or a chemical in the nature of a peach would be the antigen. Your body's creating antibodies. So the relationship between the antibody and antigen, essentially, we're going to define that as something called avidity. A-V-I-D-I-T-Y, avidity. And so the avidity is essentially the eagerness or the enthusiasm with which the antibody, the binding happens between an antibody and an antigen. So the avidity. So what I want to do is I want to talk about that, because this is important when we talk about when you get a test, you're going through the results and you're analyzing it with your patient. How do you explain what's going on? And how do you actually know if it's a legit organizational problem if somebody comes back with 100 food sensitivities on one test, which I saw this morning, or how do you know if it's maybe an infection, something like that? Okay, so causing a skew in the antibody response. So let's talk about a few of the things here as we go, and we'll just see where it takes us. So first thing I want to talk about are natural antibodies. And natural antibodies are something that are created without exposure to antigen. So somebody can say, why am I sensitive? Why do I make antibodies and why am I sensitive to papayas? I never eat papayas. Okay? Natural antibodies. So they can be protective without necessarily being neutralizing. And they also lead to an increased expression of all different types of immunoglobulins. And so the A's, E's, M's, and G's. And so when we look at antibodies, natural antibodies, these are the things that are like residual, like you get them because you have a heartbeat. And so just I want to put that out there on the table as one thing that we're going to talk about next. Okay. The next one we're going to talk about are neutralizing antibodies. Neutralizing antibodies are antibodies that lead to killing of invaders. And so that's what you think about typically when you think about an antibody is I create a soldier goes and does its job, and it neutralizes the enemy, or what the body is identifying as the enemy. So those are neutralizing. So we have natural and neutralizing. When we look at, basically when we look at the antibodies, I'm going to throw a third one in here that is even more confusing, and we're going to call it polyreactive antibodies. And polyreactive antibodies, they help by raising the total number of antibodies, right? But it has a reduced avidity. So what that means is there's more soldiers, but they're less aggressive, so to speak. What can happen is that harm can be caused with polyreactive antibodies, and it predisposes people to future tissue destruction or multiple food sensitivities, even though maybe looking at what I'm basically saying is it's not specific. Okay, so if I have an antibody that is created towards a peach, but the antibody is also identifying corn as a problem, okay, even though it's been targeting a peach, now it's starting to look at corn and maybe wheat and a potato and maybe a nectarine and maybe my thyroid. And so what happens is we start to have this polyreaction from one single antibody strand that has been designed for a reason, but the problem is that it's not specific and its avidity goes down. So its eagerness or its enthusiasm, its ability, when we talk about binding site activity, so its avidity dissipates. So that's an important thing that we're going to talk about here today. And then when we look at these three classes, there are more classes than three. Okay. However, these are the three that I want to talk about the most. And natural antibodies, they can also be autoantibodies, and it survives beta cell tolerance. And what basically it is, you have these checkpoints in the body that regulate. So you could create an antibody to your thyroid, but for many, many years, you can have B cell activity that is organizing a response to these antibodies, basically a checkpoint saying, yeah, you're allowed, and no, you're not allowed. You're going to attack the thyroid, you're not allowed. You need to be gone, okay? And so when we look at natural antibodies, sometimes they slip past those screens and we end up with tissue antibodies, not just to food and that type of thing. So it could be to your skin, thyroid, brain, whatever it is. And so this is something that's becoming more and more prevalent, not just in the United States, but around the world right now, if you look at things from a holistic perspective. One of the reasons is that the medication situation that we're utilizing in the United States today, this is just my opinion, okay? One of the medication situations that we're utilizing in the United States today is suppressing B cell activity, just as an immunosuppressant situation. And if we have some level of intelligence in this B cell activity that we're negating by suppressing B cell activity, that's where we have these natural antibodies that are starting to turn against self. They're not being weeded out at these so-called checkpoints. And so this is an important idea here, and really I want to expound upon this in a little bit different manner than just blaming it on medicine. But when we have an immunosuppressive situation, like not AIDS necessarily, but when we have an induced immunosuppression, not AIDS necessarily, but when we have an induced immunosuppressant situation, maybe from a prednisone, methotrexate, cancer drugs, all of those types of things, what happens is that we are sidestepping or blocking some of the things that have been built into your physiology to flip switches on and to shut switches off, and this happens to be one of them. And so these B cells are essentially creating they're allowing these autoantibodies to be produced and not shutting them off before they become a problem. So this is important, all right? And that happens because of natural antibodies. So natural antibodies can be polyreactive. Natural antibodies can be polyreactive. They're usually IgG antibodies in adults and IgM antibodies in babies. Okay, so this is important because typically you're going to see people with autoimmune conditions later in life, especially of a chronic nature. They're going to show up and they're going to be in this IgG category. So when you're going through testing with your patients, what type of antibody do you think you want to be looking at? IgG. So there are some tests out there that run antibody screens for food and tissues that are not utilizing IgG serum antibodies. And I'm going to throw that out there and say that currently, with what I know in this realm, I would strongly make a statement here that says, please include IgG antibodies. If you're not, you're going to be missing the boat as far as the science goes. So very important. All right. IgG levels, you can test those specifically in serum, which if you run a food antibody test on somebody, and let's say they're a hot mess physically from a symptomatic perspective, but they're looking at their food sensitivity testing, it comes back negative, clean, 100% clean. The question would be, is this person creating IgG protein serum-wise? Are they creating it? You can find that out. And so Quest Diagnostics does a good job with this, but it would be something that you can certainly organize. Okay, so I'm just throwing that out there. Make sure that you're the detective and you're looking, more importantly, looking at the underlying factors. So if somebody's a hot mess and they come back with 0 food sensitivities, are you going to leave them alone? Say, yep, you can eat whatever you want, or are you going to dig in further? So obviously, after listening to this, I hope that you're going to dig in a little bit further. So that will be important. All right, the next thing that I want to talk about then is this food sensitivity testing. Okay, so we have a couple of principles out on the table here with antibodies and food sensitivity testing. So I personally use Cyrex testing because we get IgA and IgG antibodies tested here. There are some awesome labs out there in the marketplace right now. A lot of them will do straight IgG testing, which is awesome, very valuable. But I'm always of the mindset where the more the better, right? The more things that you can get tested, the better. The more data that you have as you sit down to help a patient, the better off you're going to be. And in this instance, it's no different really, but what we want to do is we want to get as many pieces to the puzzle as possible. So that's why I use the Cyrex test, the IgG, IgA. And basically, if you can look at 180 or 165 food sensitivity tests, or 110, whichever one you're running, if we can look at that and organize, that's helpful. Now, one of the things that I want to make sure everybody understands is we're not looking at genetic allergies. We're not looking at IgE response. We're not looking at something that we can classify as an allergy, and so it's inappropriate for a provider to call it an allergy test. Inappropriate. Now, over the years, I've had an opportunity to defend cases, and not necessarily mine, but be in a spot where you do deposition work for people, for doctors, right, as an expert witness. And what happens is it starts to, you get this this sense that the opposition is always trying to dissuade you from the science, and because they can't argue the science. And so that's why the more information, the better. But then secondly, you want to make sure that you use correct grammar and you're identifying these things appropriately. So number one, we want to talk about, this is not allergy testing, okay? Not allergy. We call it sensitivity testing, or we can call it antibody response testing. Those would be the two terms that I would use for this. Number two, when it comes back with 100 food sensitivities on there, there are a couple of things that you want to be aware of. And number one, it could be polyreactive antibodies where, no, they're not actually creating antibody response to 100 different foods, but what if they are to 20 foods, and those 20 foods, or those 20 antibodies, are polyreactive? Well, then it sets off a cascade where basically the whole food test is going to come back as a problem, right? And you're going to see that on paper. Number two, We could be looking at a situation where this patient has an infection, and when you have an infection, especially in the small intestine, it amplifies the results that we're looking at with these antibody screens. And so it might be yeast, could be like a Clostridia infection, something like that. But the point is you want to be able to rule those things in or out as you have this food sensitivity test. So if you run food sensitivity panel on somebody and it comes back and it's a hot mess, you're going to want to make sure that, all right, what if this isn't legit? Okay, what if it's an infection? What if it's polyreactive antibodies? What do I do in either of those situations? So that would be super important. Next, when we look at creating a treatment plan for this patient, how long do you have them follow these food sensitivity guidelines? This is just my opinion, but I've found the best clinical results when you go at least 60 days following these food sensitivity guidelines. And I typically, if I have a patient that I'm treating for longer than a year, I'm going to run it again. And so every 6 to 12 months, I'm going to run another food panel on this patient, as long as, number one, I find that there's clinical value in it for them, and number two, you want to make sure that if their immune system profile is changing on a CBC or organic acid test or however else you're analyzing their immune system, if their immune system profile is changing throughout your treatment program, their food panels are also going to change, and it'll be important to analyze that. Like, you don't want somebody avoiding strawberries the rest of their life if it's not necessary. And so that's important, especially if it's something that's on a good for them. So we talk about chicken, or we talk about vegetables or beef, that type of thing. If they're in a spot where they're having antibody response to all the different meats on a Cyrex panel, you're not going to just have them be a vegetarian the rest of their life. That would be crazy. And so I think there's you can make a case for retesting in this instance. So that would be important. Also, when we look at this antibody response here, I want you to think of it like the weather. And so you get seasons, like I live in Minnesota, and in Minnesota you have 4 seasons. You get all 4. Like right now it's fall, and it's awesome, right? It's beautiful. The trees are on fire, so to speak, and the air is crisp, and it's awesome. But I know winter's coming. And after that, I know that March and April will roll around, and spring will be here, and then summer. And that's kind of the way it is when we talk about this antibody testing with food, is you're going to get these cycles where the patient's immune system is going to change like the seasons. Now, I've found that some patients have 2 seasons, some patients have 5. And the problem is that if you don't identify the seasons with a patient, you're in trouble, because you're treating them as if it's always winter or as if it's always summer. And this is important. Their immune system is going to change like a seasonal concept here, and it's an important thing to make sure that we're looking at. So when we talk about food sensitivity testing, every 6 to 12 months I'm going to run a panel on somebody. Okay, if it comes back and they're lit up like a Christmas tree on the test, am I going to have them avoid every single food? Not necessarily, but I am going to set up a budget. And you can call it like a food budget. So like with Cyrex, it's green, yellow, and pink, or green, yellow, and red. And you can set up a budget of the yellow and red. And the budget is based off of symptomatic relief and or progress from an objective standpoint on their laboratory testing, or maybe they have diabetes and you're regulating their blood sugar with them. You're looking at it from that perspective. Okay, so set up a budget. And you could say, yes, you can have 3 things out of the red category, 4 from the yellow, and as many out of the green as you want today. Okay? And if that's too large of a budget, if they need to be on more of a meager budget from a food perspective, then organize around that. You just want to make sure that the patient's actually documenting these things and making sure that they're following through, because ultimately, if they're not going to track it, there's no way you're going to regulate it, and there's no way that the outcome is going to be what you think it should. So one of the best tools I've found in tracking this stuff is the good old MyFitnessPal. Number one, because it's free on the App Store. Number 2, because it does an amazing job of documenting, categorizing everything for you. And you can look at the macronutrients, and that's fine, that's cool. But even more so, it just keeps a journal. The patient doesn't even need to type in the information over and over again if you don't want them to. It has a barcode scanner on it. So you just scan the barcode with the phone, and it'll plug it into the app, and you just tell them how much you had, and it's phenomenal. Okay, so the one thing you want to watch out for is that it is a weight loss app, and so they're going to give your patient recommendations on how many calories they should be eating, that type of stuff. And I find that sometimes it sabotages your progress unless you handle that on the front end. Okay, so document what we're doing here, make sure that it's organized, but don't follow any of the directions because they don't know what your labs look like. That's the statement that you use there. So anyway, when we go through this, if you can get your patients, set them up on a food budget of some sort, all right, and if maybe they have 20 or 30 things on their food sensitivity test that get flagged as inappropriate, then obviously avoid those 20 or 30 things. Just want to make sure that they don't avoid food. That's going to be important. Don't avoid food. So when we look at this, there's a couple of things that we can use the food sensitivity test for that move us into a better spot when it comes to coaching. And so there's this thing where you can go from, as a functional medicine provider, from mediocre to good to like a knockdown, unbelievable coach. Okay. And coaching is the key word. It's not about your doctoring skills. It's not about your analytical skills. It's about being a coach. So even if you're a mediocre analyst right now from a functional medicine perspective, you can knock it out of the park in the results category by helping your patients if you can develop better coaching skills. So where we transition from some of the science to the art is in developing these coaching skills. Okay, so once you have a basic understanding of physiology, once you have a basic understanding of food sensitivity testing, which is what we're talking about today, you can use it and say, yeah, don't eat the red category, don't eat the yellow category, all right? And this is a part of a treatment program, and it's not the treatment program. Food alone is not going to do what you need to have happen as far as organizing chronic disease and organizing better results for your patients dealing with chronic disease. But it is a piece of the puzzle, so don't misunderstand me here. It is a piece of the puzzle. But once you have a basic understanding of this stuff, one of the things that you can do is you can become a better coach by studying something called change psychology. Change psychology. If you can study change psychology, I would say that overall this is the one thing, and if you know me, I'm not into the one thing, like what do I do if I want to be a better doctor? This one thing, all right? But I will say it this time. This is the one area that I feel like separates an average doctor or an average nutritionist from the crowd, and it's this: become educated around change psychology. And that change psychology really is the way to bridge the gap between the art and the science of functional medicine. Change psychology is where it's at. Anybody can run a food sensitivity test on a patient and give them the results and be like, hey, there you go, I'll see you in 6 months, come back and they'll probably be better. Okay, anybody can do that. You can train an 8-year-old to do that and say, don't eat the red, don't eat the yellow, right? But the point is that there's got to be some level of coaching if you want to have lasting change for your patient base. There's got to be some level of coaching. And in this instance, change psychology is super important. Okay, so it's about becoming a better person, I think. Not that you're not a good person, but it's about becoming, like, letting that person that's inside of you out and coaching people in the right direction. Okay, so here's the thing. A mediocre functional medicine provider can read a lab and be like, yep, here's what it means. Okay? A good functional medicine provider can take a lab and they can help people that are like them. All right? Like, this is what I did for my health, so I know that I can do the same thing for you. That's a good functional medicine provider. But like an awesome functional medicine provider, they can help just about anybody because they understand the physiology, they understand the follow-through, they're good at programming, but not only that, they're good at this change psychology and applying this to their patient base. It's about being a coach. One of the places that I'm going to just recommend to you if you're looking for information on this, one of the places I'm going to recommend is a place called Precision Nutrition. And I'm not affiliated with Precision Nutrition, but they have some awesome articles, free articles, all right? Free articles on how to become a better coach. And I'm not 100% into the dogma and stuff that's there, but the coaching aspect that they have is second to none, and it's phenomenal, and I think you're going to get a lot of value at it. So anyway, just throwing that out there for you. Precision nutrition. So if you want to take this information that we talked about today just briefly from a food sensitivity testing, okay, and you apply it to your patient base, what's happening is when we stop stimulating antibody reactions over and over and over by presenting less antigenic load, your patients are going to move in the right direction, okay? Now, recognize that you're never going to be antigen-free. You're never going to be antigen-free. The goal would be is to put less gas on the fire overall. If we can do that, your patients are going to have less of an allostatic load overall. They're going to be moving in the right direction. And then the programming that we set up, or you set up, I should say, for your patients from a nutrient perspective, an exercise perspective, whatever it might be, that programming has an opportunity to let its roots sink in, to like get its teeth in there and do its job, because the overall inflammatory levels are going to be lower, literally because we're not pouring gas on the fire all day. Okay? So from a food perspective, super important. Now, there are a whole new set of scientific laboratory reports and analytic data that's coming out around basically the human genome. And I think it's cool, but I also think that what they're trying to look for is a static puzzle. And I think there are applications from a food perspective for sure when we talk about genetic predisposition, etc. But what science is looking for right now is a static puzzle so that they can say, you should only eat this way. There's no such thing. You're not going to have a static puzzle when biology is involved, right? Because basically, even if you found the entire genome, analyzed the whole thing, all right, and we said, all right, here's how you should be eating, Dr. Brad, is eat this way specifically. But for how long? We don't know. Why? Because it's going to change the genetic expression. Whatever goes in my mouth, on my skin, whatever I walk through from an electromagnetic perspective is going to change the genetic expression that my body is portraying. And so that puzzle is always changing. And so I throw that out there because I think there's going to be applications over the next 3-5 years that are going to be life-changing for people. But I want to make sure that we realize that biology is not math and that the puzzle is not going to be static ever. Okay, so don't rely on diagnostics where your coaching and your curiosity and your detective skills need to be honed. Okay, so just an encouragement there for you is don't rely on something that is ultimately going to try to weed out the skills that you have as a provider, okay? So, very cool. It's kind of the same thing in chiropractic when you use scopes or you use thermal tools to diagnose a subluxation. Those are cool, they help, but there's nothing like actually seeing it on an x-ray or feeling it with your hand, right? So don't rely on the diagnostic tool alone because the puzzle always changes. All right? All right, so when we talk about coaching, one of the big things that I got out of precision nutrition that I want to throw out here for you, and this is a theme that I'm going to have an entire podcast on coming up in the future here, but it's this: reward behavior, not outcome. Reward behavior, not outcome. So if your patient has been following a dietary program or a functional medicine program with you for 60 days, reward behavior, not outcome. If they're 20% to their goal, you're not going to reward them for reaching their goal. You're going to reward them for the behavior. So that means if they want to lose 35 pounds, don't reward them for losing 20 pounds, right? You want to reward them for sticking with it for 60 days. So there's a difference there. So I'm going to let you ponder that until the next episode that comes up with that topic. But reward behaviors, not outcome. All right, so that's all I have for you today on this short episode of the Nutrition Hero Podcast. I want to give a thank you to Dr. Candace Hall, by the way, for being with us the last episode. I very much appreciate that. If you did not get a chance to listen to that episode with Dr. Candace Hall, she was talking about some immune crossover that is starting to take over a younger generation of the population. It's called PANDAS. And I would very much appreciate that you take a listen and enjoy the work that Dr. Hall has been putting into it. And so again, thank you, Dr. Hall, for participating with us on the Nutrition Hero podcast. Until next time, you're listening to Nutrition Hero. I'm Dr. Brad Watts. Be blessed, and we'll catch you later.